Bhaskar?
Sangam.
Okay. Okay. Just wait for 2 more minutes. We'll start.
Hira, you there?
Yeah, I'm ready.
We'll wait for 2 minutes.
Yeah.
And we can start.
Sure. Thank you. So can I start sharing my screen before starting?
Yeah.
Saju sir, tell everybody to switch on their video. Saju sir, सबको video करने के लिए बोलिए sir, because it is not a good practice.
Yeah, request everyone to switch on the video. I think I think there's a lot of echo, huh? Ranga?
A lot of echoing.
Have you kept 2 phone systems on in your room?
No, sir, just one.
No, Ranga. I think Darshan and Ranga both are there. In one.
I'll ask him to mute.
Yeah, you can.
See, other than speaker and Saju sir, everybody should.
Yeah, today's organizer. What I'm trying to do, Mandal Saab, is that okay? Train everybody to be anchor. If I do, kal to main baar jayenge. So then there will be nobody left. So I want some people to get used to be a good anchor. So training everyone like that. I show thing in the initial stages. Now, it is their duty to take up the lead and then go ahead.
That anchor should be calm and quiet.
Yeah.
Yes, sir.
That
Okay.
is the first.
Okay. I request everyone to switch on the videos, and Ranga, you can start.
Yes, sir. Good afternoon, everyone. Welcome to the sports science series today. It's about physiotherapeutic, and it's a general topic as well. Today, presenter will be Hira. He's our Bangalore science physiotherapist. Over to you, Hira.
Thank you, Ranga sir, and thank you, Saju sir. Hello, everybody, and today's topic is going to be the role of physiotherapist in injury prevention. And before that, I would like to introduce myself. I'm Hira Mundluru. I've done my musculoskeletal physiotherapy from University of Pittsburgh, and I've worked in USA for a while and worked with a quite variety of sports injuries. And I've joined SAI recently, and we are working with an amazing team in Bangalore. And I hope we can share knowledge, what we have together. And maybe by the end of the session, all our amazing team can answer all of your questions. And hoping that we'll start the session. So, rehab. So everybody have a lot of conclusions on what exactly is physiotherapy. And I have heard this one thing that, physiotherapy, you attach machines to everybody. You guys do something, electrocute people. I've heard that a lot. And definitely we use electrotherapy, but that is not the only thing we do. And that definitely aids with our treatment, but that's not the only thing. And I even heard this, if it is your rest day, you should go see your physio. No, it's not wrong seeing us, but just on a rest day, maybe that's not the right choice. And we help you more even on the other days, and not just on the rest day. Rest day, maybe you have to go into hydrotherapy, or you can go into sauna, you can go to massage, but not on a rest day, you are prioritizing to go to physiotherapist. So what exactly we do? So definitely everything is a teamwork. Every department has an individual program, but at the end of the day, we see there is a lot of overlapping with a few of the measurements, few of the stuff we do. Mostly with strength and conditioning and physiotherapy, we always go hand in hand. And recently, we have a good sports strengthening team here, strengthening and conditioning. So we kind of divide ourselves so we don't overlap, and we help athlete how much however we can. And as a physiotherapist, we play important role in musculoskeletal screening. So we are talking about pre-rehab sessions even before the athlete goes onto the field. So this we usually start before the season starts, or before the competition time. And there is a whole big thing about pre-participation evaluation. And we play an important role in injury prevention too, along with strength and conditioning experts here. And we again play another important role in return to sport and preventing injury recurrence. So what exactly is a pre-participation evaluation? So this is something that we do. It involves a lot of screening. We have questionnaires in it. We have a lot of medical team who is involved, especially physicians. We have physiotherapists. We have SNC and the whole sports science who is involved. And usually we do this pre-participation evaluation once or twice a year to establish a baseline about how safe is an athlete to go onto the field or even to participate in the sport. So what are the main aims of this? So we have seen quite a lot, some of the athletes suddenly dying on the field. Maybe not so common, but I have seen in abroad a lot of people just dying on the field, just collapsing on the ground. So these usually happens with athletes because a lot of them have cardiomyopathies, which are not being diagnosed. And after you train them so much because of the hypertrophy, it happens in people who are less than 30 years of age. And because of that cardiomyopathy, and there is a lot of stress adding on because of the training, can lead to this sudden death. So the other thing what we do there is to, mainly these are the work of the doctor. And so what we try to do is to see if there is any optimal health, if the person has any issues with the sugar level, like the glucose levels, if they have asthma or any other previous medical conditions. So these are very important baseline things we need to know. If, as a coach, as a sports science person, or anybody who is involved with the athlete. So because I think these are the main things that helps us and change our training patterns accordingly. And we actually in physiotherapy, we ensure how optimal their musculoskeletal health is. And we go ahead in next slides on how we do these musculoskeletal screening and optimizing their performance. We have amazing sports science team who takes care of nutrition, psychologist, and biomechanical part of it, and so on. And again, it plays a major role in preventing injuries. We come to know what medications they are taking, what vaccinations they have, what other precautions we need to take or get into them to be equal as to the other person who does not have anything else. So, because of this, we develop a good professional relationship with the athlete. We know what exactly they are going through. For example, just talking to us or talking to the doctor, we can actually know what the athlete is going through. It's just in psychological perspective, if somebody is coming to us and they say that I am really tired, I am tired of training. So this way we actually can understand that he's tired mentally, not physically. Maybe that athlete is going too much. So we know where to refer them next. So it's just not in the psychological perspective, even in other ways, we can draw that relationship there and help the athlete. And of course, with all this, we educate the athlete how they need to maintain their BMI or improve their other anthropometric stuff, how to improve their strength, and are they conditioned enough to participate in an aggressive sport. And finally, it says how ready are these athletes to participate in sport. That's the main thing behind this PPE. So MSK screening, this is one familiar thing that we all physiotherapists from Sai Bangalore, we came up with. And we have two forms of MSK screening. One is a general one and another is a functional one. So most of the general screening is taken part by the physiotherapist, and the functional part right now in Bangalore, our SNC experts are doing it. So usually in general, we take about how is the joint integrity, range of motion, if their muscle length is good enough or not, to see if that can lead to any injury. Or on palpation, we come to know a lot of things, if the connective tissue is tight or if they have any one particular troubled area that we need to work on. And using break test, we can see how strong they are. This is more of a static strength checking than a functional checking. And balance, this is one of the most important thing that we need in our athletes. So we check that too. So if we go into a little bit more detail into general
வாங்கவா வாங்கவா அப்ப ரெண்டுக்கு மேல
So if you go into more of general screening, we divide it into lower extremities, lower back, stability and strength, and a little bit into upper extremities too. It depends upon the sport. Right now, the sport we are in Bangalore, we are involving with more of lower extremity. Of course, there is upper extremity in weightlifting and other stuff, but mostly lower extremities we are seeing a lot. So these are few testing what we do to see if, for example, here, if you look, we are concentrating too much on hip range of motion. So most of these athletes, like Taekwondo athletes, they're always pivoting on their hip. Because of this, and considering they are young athletes, we don't know what is their anatomy inside. Somebody might have a deeper groove in their acetabulum, somebody have less covering from the acetabulum, and this kind of stuff is adding a lot of impingement in the hip. So we need to check prior if that is happening, or they tend to go into that. So these range of motions help us. The first thing, if the athlete does not have the proper flexibility in that particular joint, do you think they can function very well? I don't think so, right? So they are supposed to have enough amount of dorsiflexion. If they don't have good dorsiflexion, the knee is affected, the hip is affected, low back is affected. And if they are running with the same amount of dorsiflexion, limited dorsiflexion they are running, so they might end up with runner's knee. And in younger athletes, a study states that they might even develop Osgood-Schlatter's because of limited dorsiflexion. So maybe next time we are treating Osgood-Schlatter's, maybe this is first component we might look into too, because we'll be more concentrated on just the knee, how to fix the knee. Maybe the connection is somewhere else that we need to work on. And when you come into low back, you have seen a lot of young athletes complaining about it, especially females. I know females, younger females have lower bone density, and the bone maturity is a bit different here. and a wider pelvis. There's so many factors that are leading into this. So how we can stop it, how we can modify it. So we do a special testing on low back and see if there is any neural involvement is involved because of the back, or if there is any restriction in the range of motion, or they're activating the muscles in a poor way that they're using a lot of extensor muscles instead of core muscles. We check that too. And if we come into a little bit more specific into strength and stability, we have few more exercises to see what is the quality of the movement here. So they're doing bench press, right? You can do, I can do, athlete also can do. But what is the difference between a general population doing a bench press and a person who is like elite player, an athlete doing a bench press? So we have a particular number of sets we assign to the athlete, and if we see how well they are maintaining the quality of the movement through those repetitions, and if they're reaching the particular point when they're coming back up. So there are these set of rules. I want to talk in more of a generalized way because I know there are few, we are targeting a large group of people here. So want to make things simple than go into more scientific stuff. And next, if we go to FMS, we have our beautiful friends here from SNC who does a great job. So these are the few movements we perform. Again, we see what we score it from 1 to 3 each set of exercises, and see what is the quality of the movement here. And accordingly, they prepare a score and a review. They prepare a proper strength and conditioning program according to the score they achieve here. And recently, with both physiotherapists and SNC, we noticed that a lot of athletes have really poor pelvic control, and they are able to do like really high advanced pelvic exercises and core stability exercises, but you ask them to activate their TA, they are not able to do it. You ask them any basic core exercises, they're not able to do it. Maybe here is where we need to do a lot of education to athlete, to coach, and the person, whoever is involved, that just repeating high level pelvic exercises, even any exercises, is not going to improve their strength. But let's go and progress in a stage to stage manner than just giving them high level exercises and saying that you get stronger or get kept going. So maybe that won't help. And I think because of this testing, we can actually know what are the deficits that's happening, and we can definitely help the athlete better. So according to all the scores from the MSK screen, from the general MSK screening and functional MSK screening, we gain that information and we recommend a few things to the athletes. Like I said, dorsiflexion. So in this dorsiflexion, we physiotherapists, we have different techniques to improve that dorsiflexion while they are doing their particular sport. So we can do that, or and if we know that the person is susceptible to the injury, we kind of do strengthening that part, or we do taping or other protective devices we suggest, so that the person might not be going into the injury category, still stay in the susceptible category, and while we strengthening and trying to get things going. So that is the whole recommendations, PT intervention. In coming sessions, we do have a little bit more. So we'll see you in few sessions about it. So how does injury occur? We hear a lot of people saying that, ma'am, is just, exercise pain. How do you know whether it's an exercise pain or the pain that is from an injury, right? So maybe we need to educate ourselves, like how exactly. Now you're overloading the tissue. When there is overloading on the tissue, we all know there is a micro trauma that's happening. And ignoring the pain, what we do, we continue with the activity thinking that is just exercise pain or soreness, and we continue with it. So then the pain increases. In this stage, if you try to rest, maybe the tissue has time to heal and get better. But no, we ignored it. What happens? The inflammation sets in, As the inflammation grows, there will be more tissue damage. And as the more tissue damage keeps happening, and one day you try to lift the weight up or you try to run, you lost the muscle. So again, you all end up going to surgery or longer hours in rehab, missing out your training sessions. So this is why we encourage a lot that if you have any kind of pain, please discuss with your coach, with your SNC, or with your physio. We are there to help break this cycle so that we can prevent extensive tissue injury. For example, we had an athlete coming to us with a shoulder rotator cuff injury. And that athlete had pain for 3 months, and the athlete was continuously involving in sporting activity, ignoring the pain. So after 3 months, she comes to physio saying that, ma'am, my shoulder hurt really bad. I really can't even push up. So we did some special testing that we have in physiotherapy. We came to know that this is definitely a muscle injury, a tendon injury. So we sent her to an MRI. We found out that she had a grade 4 rotator cuff tear. And now she went into surgery. She cannot do any sports for 6-8 months. So to avoid any of these adverse effects, we want to break this cycle. How we can break this cycle? By you educating the athlete, we educating the athlete. This is how we can break it, and maybe we can see better results. And this is one important thing that we want to discuss, and one of our colleagues suggested that we should discuss about this, and it's about soreness. How do you know what is soreness and what is pain? Typically, when you're dealing with soreness, it sets in within 24 hours to 48 hours. And soreness is a little bit more generalized. You cannot pinpoint like, right here it hurts. No, usually it's generalized. And after doing a few, maybe you load your muscle a little bit less. In the next session, maybe the soreness feels better, and stretching helps it. And within 3 days, your soreness will be gone. So that is soreness. And if your soreness stays for more than 3 days, and if you can pinpoint the pain to one particular spot, and even any movement or any stretching does not help that pain, then you should see us. That's actual pain, that there is some injury inside and that we need to take care of. So maybe this would actually help a lot of us to refer our athletes and taken care in the early times to prevent major injuries. So what happens if we just neglect this? Like chalta hai, this is just a normal pain. A sportsman should always have a lot of pain and injuries. What will happen if we have that attitude? So you'll see injuries like during the sport, they might have pulled muscles or broken bones sometimes, and they can have serious illnesses like heart attack, shock, asthma, and violence. Imagine you're so much stressed, you have pain, you don't know how to deal with it, and your body and your CNS system is acting in a different way than you want. So you become violent, you get more injured. These are the things we see. We really don't want to go into the messy stuff. So I think better to prevent it than being sad about it. There are few risk factors. If you have attended a few more sessions of sports science from different other locations, a lot of people talked about internal factors, external factors, how it affects the injury. So we go in a little bit more manner, how these intrinsic and extrinsic stuff leads into an injury. So, so here are the risk factors. These are distant from outcomes. So these are really a little bit far away from injury. This means here there is a chance that we can modify it. Few of them, not all of them, we can modify it and can prevent the athlete to going into injury. But here it's a little bit proximal to the outcome. So it's far away from the outcomes. Here it's closer to the outcomes. So how this affect? So internal factors are your age, gender, body composition, previous injuries, anatomy, skill level, psychological factors. All these are your internal risk factors. Here, we definitely know we cannot change age or gender. Body composition, maybe, maybe not, and previous injuries. And our recent evidences and research says that if an athlete who had a previous injury, they definitely are predisposed again to another injury. Especially if you have an ACL injury and female, there is a high chance that you'll injure your other ACL without a proper rehab and injury prevention program. So here, anatomy, what they're speaking. So if we, even in general musculoskeletal screening, we check Q angles, we check particular angles of the joint, especially in the elbow and in the knee, so that if it is reduced, we have few techniques to see. If it is more of a muscular, we can try to correct it. But if it is more of a joint and bony issue, we can't do much. So, but at least we can provide them with some supportive equipment so that the weight distribution or the force distribution is equal. And so with all these, now the athlete has become predisposed. So now we have some external factors like sports factors, like the way the game is, or your protective equipment is not proper, your sporting equipment is not proper. Sometimes the weather is hot or extremely cold. All of this add to the predisposed athlete and makes him or her into a susceptible athlete for an injury. So now at this stage, the athlete is a little bit vulnerable. And after that, we have situations like inciting events like sudden accidents in the game. You cannot control them. And an opponent's behavior, maybe they can get aggressive and come hit the athlete, or trying to do some other cheating techniques in the game, or doing some other stuff. So all these factors cause the susceptible athlete to go into injury. So this is what we need to see. We need to stop athlete to go into this level too. Okay, we want to control. We can change these factors as much as we can and make the athlete not to go into susceptible athlete. So these are few factors that can lead to injury. And there is an injury prevention model that has been designed by Von Meschen. So how we do it? So first we need to see, if you have a particular sport, you need to know what all injuries can happen in this sport. Once you have that, we need to know what are the mechanisms. Why is the injury happening? Once we come to know why the injury is happening, we can try to draw a preventive measures. And from that, we can create a program, like a whole injury prevention program, and then we can assess whether it's working or not, to see what are the high injury chances. Are there any athletes getting injured after even following this pattern? So this is more of sport specific. We cannot generalize, and definitely your sports science team would have a better idea about how to do a model prevention program for your specific sport. So there are a few principles for injury prevention, and they are: you have to have a really good physical condition. There should be an appropriate training methods, adequate amounts of rest and recovery, and you need to have appropriate equipment. Any faulty equipment, it's not going to help. Muscle soreness, whether to ignore it or whether to address it, and psychological factors, main thing that we need to address more. So here in physical conditioning, we need to see strength. Is there good strength? So in physiotherapy, what we do specific muscle strength testing. With that, we train specific muscles than giving a generalized strengthening program. So that's where we have a difference between SNC and physiotherapy coming into play. And definitely, we don't go into higher weights at this time if we have help. Otherwise, we kind of were doing job of both, or the other way around. And flexibility, as I spoke before, joint range of motion is a must to prevent any kind of injury in any sport. And endurance, you don't have good cardiac endurance, you don't have your body goes into fatigue. When the body goes into fatigue because of the endurance level, there is high chance of injury. Again, balance is an important topic because it's always keeping the CNS active, and we see how proprioception helps in preventing any of these injuries. So this is a generalized topic on how we prevent injuries, and more into interventions. We do it in following sessions by our colleagues, and the topics will be these, and you'll get to know more. Thank you, everybody.
Thank you, Hira. There will be a lot of questions now. Already somebody raised their hands.
Yeah, I see that.
Yeah, Mr. Ashok. Yes, sir.
Hello, sir.
Good afternoon, madam. Very
Good
nice
afternoon,
session.
sir. Thank you, sir.
How jacuzzi is help for rehab?
Jacuzzi? Honestly,
How the
speaking,
jacuzzi will help for rehab?
so honestly, I've never used jacuzzi for rehab purpose at all. So it is more of a, this is where there will be a line drawing between rehab and relaxation techniques. So jacuzzi is just a mode of relaxation, not at all in physiotherapy.
One thing, madam, especially in gymnastics, more of the gymnasts they will sustain injury in back. What will be the physiotherapy for that?
So again,
lower back.
So we have particular strengthening exercises and warm-up sessions we do before they go into practicing their skill. So these particular warm-ups and strengthening will help them not to have low back pains. So most of these people we have seen, they have increased lumbar lordosis, which is saying that their anterior structures are extremely tight. So the forces what are acting, the center of gravity, all of that is changing. So that's one reason they have the weight distribution in their spine is not the way it's supposed to be. That's why you see these young athletes having a lot of back issues. So they need to have a good warm-up sessions. Warm-up is just not stretching. Warm-up contains a specific muscle strengthening. So that's where we need to concentrate on. So that will help them going into any back injuries.
Thank you, madam. Thank you very much.
You're welcome, sir.
Madam,
Yes, sir.
have you gone through that stress strain capacity model?
I know about the graph. Yes.
Dick 1990 actually.
Okay, sir.
So can you elaborate that one? So that our
So
coaches will be benefited.
I think here Praveen sir can help us explain it better. Stress and strain curve.
Stress, strain, and capacity. That.
So we don't deal much with it. So we know there is a stress strain curve, and the capacity, I think it's more of SNCs who work on it. So
because,
I think
stress, that is external load. Then the strain is that is all acute and short-term effects.
Yes,
that
sir.
is called acute sports injuries. From there, that ultimately long-term and that permanent effect, that is overuse sports injuries. All ultimately it is influencing the capacity. It
Yes,
depends
sir.
upon the capacity actually. So
Yes,
this is
sir.
that stress,
Curve.
strain,
Yes.
and
So I
capacity
can tell
model.
it in a simple way. We have all had elastic bands with us, right? And every band has some property of elasticity. The same way the muscle have a proper, some amount of elasticity. So now we pull it. So that's when you're trying to strain it. When you strain it to certain amount of extensibility, and when you leave it back again, it can gain its normal position. But if you pull it more and leave it, it might gain a little bit of its physical property, but not go back into the original space. So here we know that the muscle or the structure you're targeting, you're putting too much of strain in it. And there is something called the final state where you pull it too much and the muscle has completely lost its elasticity. So that's the point where you see a lot of injuries. So maybe that is the point of capacity you're talking about, where the muscle, tendon, bones, these are not able to absorb the external force that has put on the muscle. So that's when we see these injuries.
Actually, I would just add on,
Yes,
like
sir.
when we are talking about capacity, we are talking about the overload capacity actually. So every material has a overload capacity, and that capacity, like when forces or compressive forces or any shear forces or tensile forces in that particular direction reach that overload capacity, then that material goes into that plastic region, and then it's very difficult for me for the material to come back to its original position, because molecular like adjustments have taken place, permanent molecular adjustments have taken place. So actually the material loses its elasticity at that point. So, and further if further load is applied, that bone or material breaks down. That's
And mostly the stress and strain we see, it's more applicable with tendons or ligaments, where there is a lot of force. Nothing can be absorbed because they reach their maximum capacity, as Praveen sir said, and then we see those injuries happening.
Okay, thank you, madam. And one more thing, that everybody says that some terminology related to injuries like tennis elbow, golfer elbow, then jumper's knee. So what is the difference between tennis elbow and golfer's elbow?
So, so it's about a medial condyle and lateral condyle.
Tennis elbow, golf player's elbow. It is not like that.
It's about which side of elbow is being affected, whether it's inside or outside the elbow.
No, the what kind of injury it takes place for the golfer's elbow and tennis elbow?
So both injury mechanism is same. So it's kind of overuse where the tendon gets inflamed. So the bursa underneath the tendon also gets inflamed in this process. That's
so generally for the cricketers, what that tennis elbow or golfer elbow, which injury comes?
So it can be both. It can be both because everybody has a specific pattern of taking the ball. So depends on that which part they are straining more is it depends upon that. So if they are doing more of inward shots, we'll see more of a medial epicondylitis. If they are taking more of these shots, you see a lateral epicondylitis. So we can never say only particularly this point, this tennis elbow can happen in any player. It depends upon what technique they are using.
Okay. Thank you, madam.
You're welcome, sir.
Can I go next?
Yes, please.
Ma'am, Rupesh Chaudhary, SNC Kolkata.
Yes.
So I was wondering, I saw that in your pre-participation screening, you had certain data that involved strength. So you said you're doing strength testing for particular muscles. So I'm assuming that's like a hand grip strength test and similar tests. Now, my question was, do you deal with any absolute strength scores? Like, do you maybe go to your SNC and ask him? So let's say in the case of a
you got muted. Yeah. Sorry.
Yeah. Am I audible?
Yeah.
Okay. So I was asking. So let's say it's a high jumper. Do you check for any absolute strength scores and maybe try and draw some sort of correlation? So let's say if this person's 1 RM is at a certain point wherein it's maybe 1 times his body weight or 90% of his body weight, he or she is more predisposed to certain injuries. So do you collaborate with the SNC in that manner? Do you use any absolute strength scores like 1 RM squat, 1 RM deadlift?
No, we don't use 1 RM. Thanks to our SNC team. So we use break test. That's what we use for absolute scoring. So how it is, if the person is able to resist against gravity. So if there is a full range of motion, then it is 3. Then if it is the person is able to, they don't have any jerky movements even after increased resistance, that's 4. So that's how we grade it from like a kind of 1 to 5. And in this way, it's called Kaltenberg scoring system. So that's what we use in physiotherapy. We don't use one RM. If we are doing any functional movement testing, we see how many repetitions they are able to do and what is the quality of the movement.
Okay.
Yeah.
The brake test is BREAK, right? If I'm not wrong. I'm not informed on this, which is why I'm asking.
No, it's break, actually break. So if you break the movement, then that is.
Okay, BREAK then. Right.
Yes.
Right.
Yeah,
I understand.
that's what it is.
Thank you. Thank you. That helps.
You're welcome.
Any more questions?
Hello, David. David, if you have question, you ask. If not, kindly mute your microphone. Yeah, continue. Ranga, please continue.
Yes, sir. So any questions from coaches? So this OSG, Osgood Slater's Hira,
Yeah.
is it mainly for the jumpers? How
Yeah, jumpers and runners.
it is mainly for jumpers, and so what is the prevalence and what age group does it affect? Is it for all
So-
jumpers and runners?
No, it's usually the young athletes who are below 15 years of age.
How is the recovery for the Osgood Slaters? Can you throw some light on it?
So according to the research, they have found some really good improvements after they started working on their dorsiflexion and reduce the inflammation of the tendon. So these are the two things. If we work, I think we see good results. And unfortunately, if their epiphysis is not fused yet, this is one thing that we can see a lot of recurrence, and we need to work a lot on quad strength here. That's a major thing. So a lot of eccentric loading training would help them. So the research is saying that they are seeing amazing results with dorsiflexion improvement. So we should try it. I hope I answered your question.
Yep, thank you. Archana, ma'am? Archana, you want to ask a question? Mr. Bharat, sir? Yes, sir. Bharat, sir, please go ahead.
Yeah, I wanted to ask, during injury rehabilitation, do you follow any kind of a periodized program as to when you have to do isometric exercise, when you have to start doing weighted exercise or start using resistance bands for injury rehab?
Yeah, hello, Bharat. And so yes, we do some periodization depend upon the irritability of the injury. If we see there is increased amount of pain levels, we try to go reducing the pain while we are doing isometric strengthening in that period of time, so we can prevent more injuries. So once the athlete finishes their inflammatory period, we start slowly introducing the resistance bands. In the first week of injury itself, you give them more resistance, there is a high chance of re-injury again or extending the injury. So this one, the first week of injury is very important. So once the inflammation goes down, we can load the muscle progressively. So that's what the periodization we follow too. I hope I answered your question.
Thank you.
Yeah, just to add that, do we add any like 3 set of 12 repetitions or maximum repetitions until the fatigue. So what will be our protocol for rehab exercises?
It depends upon, again, the stage where they are in. If definitely it's more in acute stage, you do not want to overload the muscle with a lot of repetitions. So initially we can go with repetitions of 10, 2 sets with increased interval in between the sets. And as we are progressing in the rehab, we can give them more repetitions and sets. So we can again load the muscle in that particular fashion.
Okay. One Mr. Rashid Aziz, hockey coach, he has asked a question in the chat box saying, bending forward and stretching is not advisable for person, those who are suffering from lower back. Please clarify.
Okay, a low back pain is a wide variety of stuff here. So we have two things. So when somebody complains of low back pain, we check which movement is painful. If the person is saying that forward bending is painful or backward bending is painful, our exercises go in that fashion. But regarding your question, when the person bends straight down, the evidences have showed the compressive forces or the forces that are acting in the back have increased in a larger amount of number. So that is leading to increase in injury. So that's the reason that we don't suggest. The particular intervertebral discs are under high pressure, high loading in this particular position. So Praveen sir, do you agree with me in this, or you have anything to add?
I think when a person is bending down, you're talking about vertebral flexion, you know?
Yeah, so they are saying
So
usually
in that case, what happens is the shear stress increases actually.
Yeah.
Compressive stress is there, but the shear stress increases, and that actually leads to, like, if the shear stress is too much, that actually, leads to that disc problem, which I think.
So that's why we ask them to not bend down straight. Use if you want to bend down and do some exercises, knee bending is suggestible. So it reduces the amount of shear forces on it. And if especially persons who is complaining of low back pain, it's better to avoid it until they get stronger. I hope I answered that question, sir.
Yeah, thank you. There's one more question from Mr. Navjit Kaushik, asking about the test you recommend for ankle mobility.
Mm-hmm.
So we didn't mention anything, but just mention about the test you recommend.
What
for
test
ankle
we do?
mobility.
So here, if we are doing just dorsiflexion, we do use a goniometer, and we use a knee to wall test. So here we ask the person to stand a little, like 12 centimeters away from the wall, and we fixate the foot, and we ask them to touch the wall with the knee and see if the person or the athlete is able to touch the knee to the wall without raising their heel. If they are unable to do that, then we ask them to step forward a bit and then repeat the same. So the difference on the scale, what you see, that is the deficiency they are actually losing. That is the degree, amount of degree of range of motion they are losing in their ankle. So if we have to just do a generalized testing, we have goniometer, and we use goniometer on particular bony prominences to see how well the joint is able to move.
So do we have any normative data, the value between the wall and the toe? Any like centimeter wise, maybe 10 centimeters, less than
I think usually it's between 10 to 12 centimeters. That's what I think, but I can recheck it. So when you're doing the testing, that's what they usually suggest.
There's one more question now, asking about please address the injuries in regard with muscle imbalances. Mr. Lingeshwar Ginjupalli, he asked a question to address the injuries in regard with muscle imbalance.
So I can talk, give an example saying, we have seen a lot of hamstrings injuries in athletes who are into running or athletes who are into weightlifting. So why is this exactly happening? And so your quadriceps is maybe too strong, your hamstrings is weak. So there is actually a value saying that if your hamstring and your quadriceps strength, if the strength difference between these two muscles is anywhere between difference is 25%, then we suggest that there is a high chance that hamstrings might have some tear or some go into some injury. So likewise, we have for every muscle. So where we have antagonistic muscle, agonistic muscles, when these don't go hand in hand, we see a lot of injuries. And again, muscle imbalance is again a huge topic. We have a lot of complications on it. Maybe Ranga sir, you think you have anything to add on to it? I think this is the information I can give in this session.
We should have a separate sessions for that actually.
Yeah. Raki, you think you can help us out? Do you have a better answer to address Mr. Lingeshwar?
Rocky?
Yeah. Hi, Hira.
Hi,
Yeah,
Raki.
so in fact, a lot of injuries, especially the chronic injuries can happen due to muscle imbalances. Like, for example, most of the knee injuries, they are related to weak glutes. So our gluteal muscles, which are also called in the layman's language, the buttock muscles, they are the primary and the most important muscles for the stability of your lower body. So anything related to your knee and ankle, those injuries can be related to your gluteal strength. So again, in terms of that is one example. Also your core muscles, especially when we talk about core muscles, the abdominal muscles. So abdominal consists of, the major muscles and the smaller minor muscles. So the major muscles helps us with the movement, but the stabilizers of your core are especially the transversus abdominis. They are the stabilizers of your spine. So usually what happens as a human being is just not related to the sports injuries, but generally also. Most of us experience back pain in some point of your life, right? So because what happens is we are erect animals, right? So usually our back extensions are very strong. But most of the time we are sitting and doing things, our abdominal muscles get weak. So the balance between the back extensions, which are your back muscles, and your abdominal muscles, I'm specifying over here transversus abdominis. So it's like a seesaw, okay? So if your front muscles and if your back muscles are balanced enough, so you will have a stable spine and you will have less chances of having a back pain. But most of times what happens is as we are erect beings, usually our back extensions dominate and then our core are weak. So that's the reason something like back pain happens. So again, in terms of, the lower body injuries, especially in the Asians, okay, if you go to see, we are more quadriceps dominant. So we usually have a weak posterior chain. So when we talk about posterior chain, it's about the gluteal muscles, it's about the hamstrings, it's about the calves, right? So again, lot of injuries, okay, especially in our setup happens because of over dominant quadriceps and less activated hamstrings and especially glutes. So in fact, most of the injuries you would see happens because of the muscle imbalance. So as a physios and along with the SNCs, which play a very very important role, when we talk about the holistic approach towards athlete, it should be also balancing the muscle strength. So that's where most of the injuries can be taken care of in the long term. And again, adding to Hira when she talked about rehabilitation. So when we do a muscular screening, when we do a MSK screening, what we physios do is we give an assessment of which muscles are weaker, which muscles are stronger, along with the FMS, which is done by this SNC. And we, in the collaboration, make a yearly program for an athlete, which is also towards the development of the muscle for the preparation of the sports, but also towards the prevention of the common injuries which happen in a particular sport. So that collaboration between the physios and the SNC plays a very, very important role in the development of the athlete. So yes, so there are a lot of injuries in the body,
which happens because of muscular imbalances. And these are just a few common examples.
Right. Thank you. Thank you, Raki. Thank you for the light. And we have Bhaskar sir question, posted a question in the chat box saying, how much time we can give static and dynamic stretching during warm up prior to competition?
So, Bhaskar sir, hi. Usually before we used to do a lot of static stretching in warm-ups, but recent evidences state that static stretching can actually reduce the amount of muscle efficiency before the competition. So that's why we encourage a lot of dynamic stretches during warm-up, which helps to bring up the heart rate and blood flow to that particular muscle. And so usually if you're doing a static stretching, it should be 30-second hold, minimum of 3 times, and not more than 40 seconds. Your muscle might go into fatigue after that. So we say usually maximum to 30 to 35 seconds and 3 sets at a time. For dynamic stretches, you can do at least 10 repetitions of the same exercise without any holds. That would still stretch the muscle and improve the blood circulation in that particular area. And you can do static stretching in the cool down phase than in the warm up phase.
So ideally, dynamic stretches are for warm up and static stretches for cool down. So
Yes.
in dynamic stretches, we hold between 8 to 10 seconds, and in static, we hold little longer than
So dynamic
20.
stretches, usually we don't hold, we do repetitions. So
Good.
for example, if you have to stretch a hip flexor, we go into a lunge position and we stretch it for a second, and then again you shift onto the next leg. That's how we do stretches, dynamic stretches. So there won't be any holds in it.
Thank you. There's one more question here from Mr. Prajit Panoli. If an athlete had a knee injury, how can a coach find out that whether it is a tendon, ligament injury, or any other injury? So he's asking from the coach's perspective. Maybe you can.
Okay. So your first indication would be pain. That way you know that it is injury. First of all, we have specific specialization tests in physiotherapy to differentiate it between tendon and ligament. Usually with tendon, you don't see much of a joint laxity. It is more pinpoint, and you see with touch it might be warm, and if you press on that particular area, it's very painful. In ligament injury, you see joint laxity. The patient is able to walk and do their activities, but they say that my knee is giving out. So that is one good example. Or maybe when an athlete complains saying that now I'm just walking, my knee feels like it's just giving out or buckling. So that is one way we can say that it is a ligament injury, or something is going on with the ligament. And a tendon is more of how somebody is pricking or poking you. How do you feel? You might feel that sensation more, and it's more localized.
I would say apply ice and talk to your physio.
Talk to your physio. Yeah, they can figure it out.
Explain you better for you without me exploring things.
Yeah.
Thank you. And Dr. Amia also wanted to ask some questions. Dr. Amia?
Hi, good evening, Ira. Nice presentation.
Thank you, sir.
Yeah. Anyway, it was a nice topic when you spoke about dynamic and static stretching. But
Yes,
also
sir.
before, when you're warming up, there is no question of any timing. Like
Yes.
when you're talking about hold, there is no hold. So 1-2 seconds also doesn't matter. It's a very it's kind of a cyclical quick movements,
Quick
which
movements,
is more recommended.
yes.
Yeah.
Yes.
So that's all. So there's no time, I guess, between
No time.
what you're doing.
Yes, sir.
Yeah. Anyway, good presentation. Yeah.
Thank you, sir. Thank you.
So the question again from Navjit, if I don't have...
one thing in that. No,
Yes, sir.
if at all, I mean, even if at all you're doing static stretching, doing in the warm up, doing up to 30 seconds is not a good idea. So their maximum, even static stretches only last for maximum 6 to 10 seconds, not more than that.
Okay, sir.
Okay, thank you, sir.
Thank you, sir.
Ma'am, excuse me, ma'am, this is Vijish.
Yes, Vijay, sir.
Is it advisable to do static stretching in the limbering down time.
You mean cooling down time? Your voice was breaking.
Yeah.
So yes, it is more suggestible because now the evidences are suggesting that if you do static stretching, the amount of power the muscle is supposed to generate, it is not able to give that amount of efficiency. So they are trying to keep it to the end of the session. And another way you look into it like this, your muscle is under a lot of load when you're doing training or when you're doing exercises. Now in that state, all your muscles are into a contracted position along with your connective tissue. So it would be helpful if we do later so that your muscles can relax in a better way. And at the same time, your body also, your cardiovascular system, everything comes down. So that way we can prevent more injuries after the workout. And it will even help in reduction of exercise induced muscle soreness, or or we can say as DOMS. So delayed onset of muscle soreness. This can be also prevented by static stretching in cool down.
Ma'am, nowadays the coaches are not used to do static stretching, because when we are after a plyometric or a heavy weight training, we used to avoid static stretching at all. Why?
Okay.
Because most of the coaches are saying like it will affect their like fatigue level. Something like the muscle will get overstretched that time because it is already very tight.
Okay.
What is your opinion about that?
So I think in plyometrics, when you're doing, I think the muscle is under a high load. So I don't see how the muscle is actually overstretching here. So I think that is a little bit misconception that is happening. So usually after you do plyometrics, that is even more advisable to do static stretching, because we need to reduce the amount of load what the muscle has been through. So I think Raki has something to add on here. I think she's raising her hand.
Yeah, so as sir mentioned that, even there are new research which states that nowadays, usually if you skip your cool down post your session, it's better, it's just in research. A lot of studies which states that one can avoid stretching post session. It helps for faster recovery. But then again, it's a topic of research. We don't have a proper evidence, and there haven't been systematic reviews to mention that, okay, this is the ultimate clinical evidence. But then definitely there are studies and there are few teams in India, the national teams, which don't stretch post their sessions. Yeah. But again, it's a question mark. So there are few teams which follow this protocol, and there are few teams which doesn't follow this protocol. Yeah.
So maybe it is still in a level of case study than any randomized or systemic review. So if you want to experiment, let us know how the athletes are feeling, please do. But at least till now, the systematic review is saying that it is helpful. So let's see what the future research says.
One of our high performance director from Germany, from AFI, he was telling like, if you are doing more kind of static stretching, it will reduce the elasticity of the muscle, and finally it will reduce the speed as well. So most of the coaches are doing it for recovery and injury prevention, but in his opinion, it is not suggestible because it reduces speed and elasticity of the muscle.
Yes, sir. The same thing we are saying. That's why we don't do it in warm-up. We do it in like recovery or cool down. That's why we are doing it then, so that they immediately don't have to activate the muscle and do a running or do a weightlifting. So exactly what he said is right. That's what we are following too. So the more specification is before the skill training, we should not do it.
Can I? Yeah, hi, this is Tilak.
Even after the training also, he is not suggesting to do it.
Can I add, madam? Hira, madam, can I add something to this?
Yes, sir. Yes, sir.
See, whatever the plyometric sir was talking about, Vijay sir was talking about, it takes place in a phase like eccentric, amortization, then a concentric phase. In eccentric, stretch of the agonist muscle, okay? Then the amortization phase will it will be a pause between the phase 1 and phase 3. The concentric phase will be like shortening of the agonist muscle fibers and whatever the energy is released. If you are not going for a static stretch, what I feel is whatever the muscle spindles detect a rapid stretch, that you won't feel it again. If the improper recovery is there, as I said, the Russian scientist has told that if the whatever the static stretch is not done, like if done, the ability is lost. I won't believe in that, because again I want to stress here, the training is not generalized. Always the training is specified to a particular individual. Yeah, in that Russian coach case, it might have happened like that, but in general, what I feel, there should be a static stretch after the plyometric. I don't think so that whatever the abilities have inculcated in an athlete, it won't be lost. What I feel.
Okay, I think Dr. Ameya has something to add here.
Yeah, hi. Good discussion. Actually, good point by Vijay got up. See, there are multiple schools of thoughts on this, which also vary on what sport the research has been made. For example, with powerlifters, weightlifters, and all that, they think that when you start stretching, okay, as he said, elasticity is going to increase, and they might end up losing hypertrophy. But then there is also a thing. There's a difference between fatigability and perception of fatigability. Okay. Similarly, when you're stretching, there are some runners, especially long distance, who want that kind of stretching. So all the race walkers or marathoners, ultra marathoners, they prefer, you see, their body is very flexible because their joint angles, ligaments, all that, they are equally strong. Not to say that the powerlifters have weak, but they have to be more bulky. Okay. So there is more hypertrophy, more muscle fibers, and the size is more in a limited space. Whereas in the runners, when you see the lean body physique, it is all well spaced out. So it also depends on your sport as to when you want to place the stretching. And as Tilak sir also rightly said, you can't generalize it. Ki, Baba, this one has said so, so I will go for stretching. Oh no, this reading is said so, I will not go for stretching. You have to pick and choose your athletes based on muscle mass and the kind of activity or sport he or she is in.
And to add on to Mr. Dr. Ameya's this one, it depends on the individual flexibility level also. What kind of flexibility he or she has also. It depends on the event also. It depends on the macro or microcycle in which the athlete is also. Everything matters here. It is not only a thing that after plyometrics, the stretching should not be done or should be done like that.
Thank you.
So Vidit, we hope we answered your question.
Thank you, sir. Thank you, madam.
You're welcome, sir.
And Hira, how would this foam rollers nowadays? We use a lot of Theragun and the massage guns. How effective are these tools in recovery?
So it's kind of a concept of massage. Everybody is not accessible to massage therapists these days. They are definitely on high demand, especially in sports settings. So this is one way of relaxing a muscle other than using static stretching or dynamic stretches. We try to lengthen the connective tissues using in a compressive manner. So there are two techniques how you can stretch your connective tissue. When you're doing your normal stretching, the connective tissue is not stretched to that extent when you're doing either cupping or when you're doing any of these massage techniques like foam roller and other stuff. So we use, one is a compressive technique to use a connective tissue stretch. The other one is a decompressive technique. So both follows the same. So here we are trying to lengthen the tissue along with the muscle. We are trying to lengthen the connective tissue too. So the process of increased blood flow to that area is increased, and that helps in recovery faster than just doing any normal stretches or just going in the pool. So it has a better outcomes this way than just using one technique. So for example, if you go for a steam, so you know that your muscle is in such a way that it's relaxed. after you finished your steaming, after you finished your sauna, if you try to do foam rolling, so imagine the muscle extensibility level. It will be even better outcomes using these two techniques together than using any one of it.
Any questions? Neha ma'am asked our badminton coach. Neha ma'am
I
asked a
think
question.
before that we have a question saying if we don't have goniometer, how we can test ankle mobility.
I think Navjit Kaushik sir asked the question earlier. So you said you started with goniometer and then you said about the knee to wall test. I think
we can do that. And we can even use nowadays we get this inclinometer apps on the phone. So you can use that to measure how much it's able to move, or you can even use a tape to do between your little toe and shin. What is the distance between that? Even that way we can get a objective measurement, a quantitative measurement of the ankle mobility.
So again, Vijesh again asked the question. Vijesh,
IT band issues?
Yes, IT band issues.
Okay, so it's never actually the root cause is not IT band. So it's always the piriformis that is causing issues in the IT band. So your piriformis, your IT band, your TFL, it's a chain. So first your piriformis go into tightness if you have weak glutes or if you have weak rotators of the hip. So that's the muscle first gets into tightness. So as prolonged tightness in the piriformis irritates the fibers around or the tissues around your greater trochanter on the hip. So that's where your IT band is trying to cover this tendon of the piriformis and other structures. That's when it gets inflamed, saying that, oh, now I have a hip pain whenever I try to do some rotation or whenever I try to run. So that's how the IT band starts. So whenever if you have your athletes complaining, or you can definitely refer them to us to avoid it into going into the IT band. Make sure that you give proper warm-up and good flexible exercises for your piriformis along with strengthening too. So as Raki said, we have really weak posterior chain. So we try to increase strength in it. So we can go into this improving or avoiding IT band issues. And even sometimes your sacrum also plays very important role in it because of unstable or because of a lot of other laxity in the SI joint structure. It's your sacroiliac joint. If you have any laxity in that or instability in that joint also, it can cause a lot of IT band issues.
Thank you. And Mary ma'am's question. Can we go for dynamic stretching early in the morning at 6:30 a.m. because our session starts at 6:30 a.m. with the NCO trainers?
Yes, ma'am, that would really help dynamic stretches because your body is completely relaxed throughout the night. Definitely the blood flow to the muscles is not so great. It is good, but it is not to the level where you can jump up into the exercises. So dynamic stretching in the morning sessions, it'll help even better.
Okay, there's the other question which contradicts to that. Neha ma'am asked a question, especially in the morning times, we'll go before warm-up static stretch. If we immediately go dynamic stretches before the warm-up, there's a chance of injuries because the body is totally resting position. What do you will say about this?
So if you're really concerned about that, we can actually start with a general, jog in a place. You can try to do some slow dynamic activities, not just the stretching. So the whole concept of dynamic stretches is to gradually you can increase your heart rate while you're stretching. So you don't actually go into any injuries. So if you're thinking about more of dynamic warm-up, burpees, jumping jacks, no, we are not starting that. We have lunges, we have side stepping, we adductor stretches. So, and these are the main things that we do before you even jump into high intensity exercises. So I think there is a very, very minimal chance of injury if we do that.
We can add few mobility exercise also in warm up,
Yes.
so that we can avoid getting injured. I think ma'am question is, some people say don't stretch the resting muscle, the cold muscle, when it is not warmed up. If we stretch it, then we might end up injured. To start with minimal amount of warm up with basic dynamic stretches and mobility exercises, we can avoid injuries.
Yeah. In that case, we can do like light mobility exercises like Ranganathan sir said, or light jogging exercises. Usually these people kind of walk and come to the sessions. So by the time they walk and come, usually their body is a little bit more warmed up. They are not just directly getting out of the bed and coming there. So the body is a bit warmed up. So we can do these kind of stretches.
Yeah, Raki has raised her hand. Raki?
Yeah, can you hear me? Yeah.
Yes, please.
So also, these days as a part of warm-up, before the actual warm-up starts, also foam rolling really helps.
Yes.
So foam rolling helps in the way that it activates the muscles. And when there's a muscle activation before any kind of activity, the movement, whether it's warm-up or mild jogging, it is much more efficient. So this is a new concept in the sports science, that foam rolling helps to activate the muscles even before any kind of dynamic activity or a static stretch happens, because it activates the muscle fibers, it gets all the ATPs in the place, and that's how it physiologically helps. And that's how it helps with the quality of the movement. So also we can consider doing foam rolling for the activation part. And also it helps to reduce the soreness from the previous day activity. So it has a double effect. It also releases the muscle. So there's also like a dual recovery, and also at the same time, there's a muscular activation which happens, which will help you with the further activity during the session.
Yeah. Yeah, that is so true, Raki.
Yeah. Thank you.
I think if there is no other questions, since we have 4 o'clock orientation, we can have some break so that we can prevent our eye injuries looking at the screen for a long time.
Thank
Any
you everyone
questions?
for actively participating in the session. Hope we'll come up with more informative sessions that will help all of us. And thank you so much, Saju sir and Ranganathan sir, for hosting this.
Well done, Hira, and well done, Ranga. Both of you have done a very good presentation. Yeah.
Thank you, sir.
Thank you, sir. Thanks for the opportunity.
Keep going, keep going, keep going.
Thank you, sir.
See you all at 4 o'clock orientation.
Yeah, see you on the other side.